my name is Brittany Mitchell. I'm an occupational therapist and certified hand therapist at the OrthoVirginia in Chesapeake. And today we're going to talk about scar tissue management. So I have Zalea here. She's our rehab tech, and we are pretending that she has a distal radius fracture scar. And so usually I don't educate much on it initially if the scar is open. If we have the wound and it's open, we want to wait until it's completely closed before we start any cocoa butter or vitamin E oil. You definitely want to talk to your surgeon and make sure you guys have the same plan for that. So usually I tell people to start out with polymers or vitamin E, and you would just take a little tiny bit of it. And I would tell my patient, you want to start just a little, use your thumb, go clockwise, counterclockwise, side to side, and then go from the top down. So the reason why we do that is because if we don't massage the scar, it's going to get very, very tight, and then it's going to impact our motion, and it's going to impact the tightness of the skin. It's also going to be very sensitive if we don't massage it. So I basically tell people 2 minutes a day, once in the morning, once at night, maybe even up to 5 minutes. So like I said, the scar can get very sensitive. So in this case, I will sometimes tell people to use something called a sensory stick, which I make here in clinic. So I would tell Zalea she would need to start with the smoothest texture and work her way up to the more rough textures. So this is going to help us be better about interpreting our environment. A lot of times when we go to don a coat or when we go to do laundry, we tend to have a lot of sensitivity in that scar. So it's always good to help and get some stimuli on there so that when you go to do those tasks, it's not uncomfortable. So if we have someone who has a very sensitive scar, again, I sometimes will issue someone DISM, which is this little blue piece here, and I have them place it atop of the scar, have 2 fingers come in and do a nice gentle massage that way. Another thing that we utilize in hand therapy, or you can use at home, is a scar gel pad. I have one right here. And so you would only want to cut just amount for the length of the scar. So for Zalea, that would actually be just about right actually. So I would even have her cut it in half and place it on there. I would say up to 12 hours overnight. 8 to 12 is fine. And then they would remove it during the day. So another thing you can use is KT tape. We have used KT tape a lot for scar management if the DISM doesn't work. So that's all I have today for scar tissue management. Thank you so much and have a great day.